This is major assignment number 3, final physical exam. My name is Madison Williams and I consent to be recorded in the video for this class.
My name is Stephanie Zawacki and I consent to be in this video for this class.
Throughout this exam, I'll be asking 3 review of system questions and 1 health promotion question that corresponds to each body system being assessed. Hi, my name is Madison and I'll be the nurse taking care of you today. Today we'll be performing a physical assessment. We will begin with your eyes. I have 3 questions to ask you. Do you have contacts and glasses that you wear on a daily basis?
Glasses, no contacts.
Do you have blurred vision when you wear these glasses?
No.
Have you ever had any eye surgeries?
No.
And do you go to your annual eye exam appointments every year?
Yep.
Good. We'll be performing the visual acuity Snellen eye test. You'll be putting a card over your one eye, reading as far down as you can, then switching eyes.
E, E, F, C, Z, P, F, E, L, O, P, Z, D.
Can you go another line down?
D, E, F, P, O, T, E, C.
Next, we'll be performing the confrontation eye test. I'm going to cover our eyes up on the same side, and you're going to tell me when you see my finger.
No. No. No.
Switch.
No. No. No.
Good. Next, we will be evaluating the extraocular movements using the 6 cardinal positions of gaze. You're going to look at my finger, and you're going to follow it with both eyes. I'm evaluating for nystagmus and making sure that they track evenly. Focus back on my finger. Next, we will test for accommodation. You're going to stare at my finger and follow it with both eyes. We're checking for strabismus, which is crossing of the eyes, as well as nystagmus, which is involuntary eye shaking. Next, I'll be shining a light into your eyes to test for your pupillary reflexes. You're going to stare at me, and I'm checking for direct pupil constriction, as well as consensual pupil restriction. I'm going to also be assessing for the sclera and the corneal color, shape, and alignment. Next, we'll be evaluating the ears. I have 3 questions to ask you to review this body system. Do you wear hearing aids?
No.
Do you ever experience any ringing in your ears?
No.
And do you have any trouble hearing?
No.
One health promotion question that I'm going to ask you is, do you ever listen to any loud music or use any loud machinery?
Sometimes.
Okay, so we're going to make sure that we lower the volumes, and while using environmental work machines like leaf blowers and yard equipment, we're going to wear safety ear protection to protect our hearing as we get older. Do you mind to pull back your hair so that I can inspect your external ears? I'm going to look at the size and the shape of both of your ears to make sure they're symmetrical, there's no lesions or no redness or any swelling in either ear. Next, I'm going to palpate the ears by pushing on the the tragus and then the mastoid process and seeing if there's any tenderness or any pain in any of these regions. Next, I'm going to evaluate the external ear canal by pulling back on the pinna, up and back, and looking inside to see if there's any discharge, any lumps, lesions, or any redness apparent. Next, we're going to perform the whispered voice test. You're going to cover your right tragus, this part, by pushing in on it, and I'm going to go behind you 2 feet away, and I'm going to whisper 3 things into your ear. You're going to repeat them back to me. Y, Z, K.
Y, Z, K.
And then you're going to trade ears, push on the other trachea, and then I'm going to go behind you and I'm going to repeat another 3 series of letters and numbers. ZP5.
ZP5.
Good. We would repeat if the patient cannot repeat those appropriately back to you. Next, we're going to be moving on to our examination of our nose, sinuses, and our mouth. 4 questions. 3 review system. Do you have any history of sleep apnea?
No.
Do you have any trouble swallowing?
No.
And do you have a history of any facial injuries or injuries to your nose?
No.
Good. Health promotion question is, do you smoke or chew tobacco products?
No.
Good. I'll first be inspecting your nose. So I'm going to look for symmetry, any lesions, or any deformities present. I'm going to ask you to tilt your head back upwards, and I'm going to look in each nasal cavity to see if there's any asymmetry or deviated septum present. I'm going to ask the patient now to sniff deeply, and then cover one nostril, repeat, blow out, and then do the opposite. Good. This was checking for any obstructions, any discharge, or any nasal polyps or rhinitis. Next, I'm going to palpate the sinuses. I'm going to begin by asking the patient to relax their face. I'm going to take my thumbs and I'm going to press up onto their eyebrows underneath of them to see if there's any pain, any tenderness, any lumps, or any firmness underneath of the skin. Next, I'll be inspecting the mouth. So I'll be visualizing the patient's lips, looking for any cracking, redness, any discoloration, or any pallor color. I'm going to ask the patient to smile. I'm going to look at their teeth and see if they're symmetrical and if there are any visually missing. I'm now going to ask the patient to open up their mouth and say, ah. I'm going to take my tongue depressor slightly off center and evaluate and grade the tonsils. So say, ah. I'm going to be looking for the distance between the uvula and to see how visible the tonsils are, to see if they're touching or what grade they are. I was evaluating for any exudate, which this patient does not have, and her tonsil grade is a 1+, which they are visible. That is normal. The patient's uvula raised midline, and there was no lesions or any other abnormalities present. Next, I'm going to ask the patient to open up their mouth, putting their tongue inside of their mouth, and then I'm going to be looking at their mucosal lining as well as their hard and soft palates. I'm going to be analyzing their Stenson duct, which is where the teeth and the gum line matches. Next, I'm going to ask the patient to stick out their tongue. I'm going to look to make sure that it protrudes midline, and then I'm going to ask them to move it from side to side and then up so that I can see underneath. I'm analyzing if there's plenty of saliva present, but not in excess. This assesses your cranial nerve number 12, which is your hypoglossal nerve. Next, we're moving on to your head and neck examination. 3 review of system questions. Do you ever experience any headaches?
No.
Do you have any dizziness?
No.
Do you have any neck pain?
Occasionally.
A health promotion question. Do you have any trouble with your range of motion, your movement of your head and neck?
Occasionally.
A health promotion activity that you can do is stretching or yoga to increase your range of motion. I'm going to begin by palpating your head and cranial lymph nodes. I'm going to be palpating your pre-auricular, your post-auricular, occipital, your submandibular, your submental, your anterior cervical, your posterior cervical, and your superior clavicle. I'm palpating for any firmness, any lesions, or any other tenderness or pain in that area. Next, I'm going to visualize the position of the trachea. I'm going to make sure that it's midline and symmetrical. I'm going to then take my thumb and forefingers and palpate the thyroid. I'm going to ask the patient to put their neck up. I'm going to push from one side to the other, making sure that it is movable, and palpating for any lesions or other issues. And I'm going to auscultate for any bruits. I'm going to ask the patient to take a deep breath in and out. Take another deep breath in. And see if I can hear anything, any bruits present. Next, I'm going to palpate the carotids to make sure that there is a pulse. I'm not going to press too hard to obstruct any blood flow. Pulses are present and nothing abnormal is present as well. Next, I'm going to check the range of motion for this patient. I'm going to ask them to take their ear and touch it to their shoulder, and then do it to the other side. I'm going to ask them to look up at the ceiling, and then put their chin to their chest. Next, I'm going to ask them to look up and straight. I'm going to ask them to push against my hand, assessing for strength. Good. And then I'm going to put my hands on their shoulders and ask them to shrug their shoulders while I push down slightly. I'm going to make sure that their strength is equal on both sides and that they have an appropriate amount of muscle movement. Next, we'll be examining your lungs and thorax. I'm going to ask you 3 review of system questions. Do you have any trouble breathing?
No.
Do you ever experience a cough?
No.
And do you experience any chest pain?
No.
A health promotion question is, do you do any form of cardiovascular exercise?
Occasionally.
And do you have any trouble breathing doing that?
No.
Okay. The average adult should get at least 2.5 hours of moderate to intense workout per week. We're first going to begin by inspecting the patient's breathing and respiratory actions. I'm going to ask the patient to just sit upright and breathe normally. I have already taken vital signs and know her respiration rate, which is 14, and I am looking and noting any costal angles, abnormalities, and seeing the thoracic expansion. Next, I'm going to test for tactile fremitus, which is done by placing the ulnar portions of my hands on the patient's back and asking them to repeat the word blue moon.
Blue moon. Blue moon. Blue moon. Blue moon. Blue moon.
I'm feeling for vibrations and making sure that they are equal and symmetrical on both sides. I'm going to now percuss the patient's posterior chest. I'm going to make sure that I am symmetrical on both sides, noting any resonance, dullness changes, and any hyperresonance, which would indicate a pneumothorax. Next, I will auscultate the patient's lung sounds, starting at the top and asking the patient to take a breath as I move my stethoscope, making sure that the lung sounds are equal and symmetrical on both sides, and letting the patient know to let me know if they have any dizziness or need to stop to take a break. Making sure that if there's any wheezing, I would note that this was present. And again, making sure that all lung fields are clear. Next, we'll be inspecting the anterior portion of the patient's thoracic area. I'll be noting any abnormalities or difficulty breathing, and then I'll begin by placing my hands underneath of the patient's on the rib cage and feeling for chest expansion when the patient takes a deep breath. So I'm going to make sure that this is okay with the patient, and then I'm going to ask them to take a deep breath. My thumbs are going to separate, which notes lung expansion. Then I'm going to percuss the anterior portion of the patient's chest, noting any hyperresonance, which is not normal, and any resonance and dullness that is normal and indicates healthy lung tissue. Then I will be auscultating the patient's breath sounds, asking the patient to take deep breaths, noting any wheezing, any abnormalities, any changes at the bases. Next, I'll be auscultating for egophony. I'll be asking the patient to say the word key,
Key. Key.
and listening to see how it sounds to make sure if it is normal or abnormal. Next, I'll be assessing the anterior tactile fremitus by asking the patient to say blue moon again.
Blue moon. Blue moon.
I'm feeling the
Blue moon.
vibrations being equal.
Blue moon.
And now I'm going to auscultate for the breath sounds one more time to listen for bronchophony, which is normal breath sounds and airway passing. Next, we'll be evaluating your cardiovascular system, which is your heart. 3 review of system questions are, do you tire easily?
No.
Do you ever experience any swelling of your legs or feet?
No.
And do you ever have any dryness or blue discoloration of any of your extremities?
No.
A health promotion question that I'm going to ask you is, do you monitor and or limit your salt intake?
Yeah.
Good. First, I'm going to begin by inspecting your chest area. First, we're going to begin by visualizing your chest area and visualizing your jugular veins and seeing if there's any bulging or any abnormalities. Then I'm going to begin by auscultating your heart sounds. Your second right intercostal space, you're just going to breathe regularly and listen to your apex, listening for any extra sounds. Then I'm going to your pulmonary, your second left intercostal space. Then I'm going to your Erb's point, your third intercostal space, which I'm listening to your S1 and S2 sounds. Then I'm going to your fourth intercostal space, which is your tricuspid, making sure that the rhythm is equal. And again, that there's no extra sounds. Then I'm going to your mitral. Next, we're going to be examining and evaluating your abdomen. So 3 review of system questions that I'm going to be asking are, do you have any abdominal pain that you ever experience?
No.
Do you have a history of any GI problems such as colitis, hernia, or Crohn's disease? No. And do you have any food intolerance?
No.
A health promotion question that I'm going to ask you is, do you have your daily fiber intake met?
Yep.
Good. First, I'll begin by inspecting the abdominal area. I'm going to raise the patient's shirt, and then I'm going to look from the side to look at any contours or any ascites or any other issues. I'm going to then be making sure that I inspect for skin color, any scars, and any asymmetry. Then I'm going to be auscultating for at least 30 seconds in each region, listening for vowel sounds, noting if they're hyperactive, absent, or any other abnormalities. Then I'm going to be slightly percussing in each quadrant, feeling for any masses, any tenderness, with light palpation. I'm also going to be auscultating for the aorta, noting any abnormalities, then left renal arteries, the iliac artery, noting pulse, and femoral artery on both sides. Next, I'll be percussing each quadrant, noting again any hyperresonance, any dullness, any tenderness, and any changes. Next, I'm going to be performing Murphy's sign test, which is putting my fingers under the liver border and asking the patient to take a deep breath. This will indicate any issues with the gallbladder, known as cholecystitis, if there is pain and the patient cannot finish the inspiration at that time. Next, we're going to be performing the fluid wave test, which will test for ascites. I'm going to ask the patient to take their right hand, the ulnar edge, and place it midline, right in the middle, up a little bit where their umbilicus is. Then I'm going to take my left hand and place it on the patient's right flank, and then my other hand on the other side. Take my right hand and give the patient's left side a strike, and see if there were any ascites, it would shift across the midlines. This patient does not have ascites, so I did not feel the fluid wave move all the way across to my left hand on the patient's right side from the tap on their left side. Next, we're going to be performing the iliopsoas muscle test, which is done by having the patient raise their right leg, and then I will push against it and they will push against me, and if any pain is present, the patient will have indication of appendicitis by having pain in their right lower quadrant. Next, we'll be examining your neurosystem as well as your musculoskeletal system. 3 review system questions is: do you ever experience any seizures or have a history of seizures?
Mm-mm.
Do you ever have any tremors or any shakiness in any of your extremities?
No.
And do you have any difficulty speaking?
No.
Health promotion question that I'm going to ask is: do you use alcohol? And if so, how often and how much?
No.
Okay, good. I'm going to be beginning by asking the patient to hold out their wrists. I'm going to assess their pulses and make sure that they're even and appropriate. I'm feeling for the temperature and inspecting the patient's skin. Next, I'm going to ask the patient to squeeze my fingers as hard as they can, make sure that they are equal in strength. Then I'm going to ask the patient to push against my hands, make sure that they're equal, as well as I'm going to ask them if they can raise their hands over their head. Good. I'm going to ask the patient to perform the Fallon test, which tests for carpal tunnel. They're going to take their wrists, push them together, and you're going to do this for 60 seconds to see if there's any tingling or any numbness or any abnormal feelings experienced that would indicate carpal tunnel syndrome. Next, I'm going to be inspecting for scoliosis. So I'm going to have the patient hunch over and reach down as if they're reaching down to their toes, bend over, and make sure that the spine is aligned properly. First, we're going to do the assessment of coordinated motion test. We're going to ask the patient to close their eyes and touch their finger to their nose, one at a time. Then I'm going to ask them to remain in a neutral position with both hands down by their side, and then I'm going to ask them to close their eyes again with both feet together. I'm going to make sure that the patient does not fall over. I'm going to slightly move them from side to side to test their balance. Next, I'm going to ask them to open up their eyes and perform tandem walking, which is putting your heel to your toe, and seeing how the patient has balance. Ask them to turn and repeat it again. So I'm going to ask the patient to perform another cerebral test by having their palms face down on their thighs, and then quickly ask them to face palm up to palm down and do it quickly. This is the rapid alternating movement test. Next, we're going to perform some sensory tests by asking the patient to close their eyes and open up their hand. I'm going to draw a letter or a number on their palm, and they're going to have to indicate what letter it is or
A.
number.
2.
To the other.
I. B.
And then I'm going to ask them to close their eyes again open up their palm, and then feel the object in their hand and see if they can identify it by squeezing it in their hand.
A rubber band.
Good. Keep their eyes closed, see if they can identify
Okay.
another item with their other hand.
A pencil.
Good. The styrgnosis cerebral test. And the number or letter test was the graphphasia test. And the styrgnosis test was the identification of an object in the patient's palm. Lastly, we're going to perform the Balamont test by asking the patient to relax their lower extremities. You're going to take your hand above the patellar and then push up on the kneecap. If there is any large effusion, then you would understand that there is inflammation and swelling and fluid behind the kneecap, the patellar. We're going to do the heel to shin test by asking the patient to take the heel of their right foot and place it to their knee, and then put it all the way down their shin, and then repeat on the opposite side. We're going to analyze to see if it is equal, symmetrical, and mid-line down each shin. This concludes major assignment number 3, final physical exam.
Thanks
Thanks for watching!